Dr. Jim Cardon is going to open this up today to talk about the boosters and an update overall in COVID. So go ahead, Dr. Cardon.
Thanks. Good afternoon, everybody. Thanks for coming to join us. Keith and I hopefully can continue to kind of bring clarity to what's going on. As I joked with Keith, unfortunately, there still seems to be a lot to talk about with COVID. It's not calming down at all. So appreciate your willingness to get here so we can get the information out. A couple of things that we wanted to sort of cover and open up for discussions with you guys, answer questions is somewhat the continued increasing rate of positive tests that we're seeing and how that and how we're looking at that, planning for that. Second piece is boosters, what's going on now with the at-risk population that's been approved in terms of what we're rolling out there, and then really planning on the broadening of that to boosters for all. Just recently announced to be ready to start doing that mid to late September, and where we stand in that process. So that would be the overall intent. I'll start by giving a little bit of an overview. Certainly, we continue to monitor very closely the positive rate and are seeing upticks of our hospitalized patients. Thankfully, intubated patients in the ICU remain relatively few compared to the number of positive we're seeing. So that's encouraging and would continue to suggest that vaccines are having an impact on really reducing the mortality and morbidity of this. But there's no question that the variant is likely, causing a lot of both the breakthrough infections, and obviously it continues to be a very serious problem for those that are unvaccinated. We are continuing to expand our testing capabilities. As you recall, we don't have the big drive-throughs that we had in the past, but we're continuing to expand our testing across our Go Health sites, our partnership with Quest, and looking for additional options as we anticipate that testing will become increasingly important as we move through the fall and winter as more symptoms sort of show up. And being able to manage symptomatic testing is a different animal than those who are just being screened for pre-ops or otherwise. So that those plans are well in the works to get out in front of that. From a vaccine perspective, uptick in terms of the first doses continues to move along. I think we're making progress, certainly by no means the rate we would like to see. That work will continue as we look at our vaccines, as we talked about. We're doing about 900 vaccines a week in the first doses that we've seen. Just short of half of those are in the high priority zip codes. So we're still continue those efforts, and our mobile teams are still out, making sure that we're bringing access where we see opportunities. And we're still seeing small numbers, but pretty consistent uptake there. As we move towards being proactive around boosters for the immune compromised, those vulnerable populations, as you may or may not recall, but as we were doing the first set of vaccines, we brought on a capability that allowed us to reach out to our known patients and text through text, offer them opportunities to both schedule or come in for vaccines. We're using that same functionality now and have sent out messages to all of the folks who we saw as the appropriate candidates that we had records for, trying to proactively engage them, bring them in. We are administering vaccines. We've not seen a huge volume in any of our vaccine centers yet, but we anticipate that volume is going to grow as it goes forward. We're fully prepared. We have plenty of vaccines. Right now we have plenty of access. And moving forward, we are in the planning stages to really be able to handle the kind of volumes that we did with the first go-round of vaccines as we start planning the folks that are going to get expanded access in, like I said, September timeframe. So I'm going to stop there and hand it over to Keith to add a little color commentary to all that and give you a little bit more detail.
Yeah, I mean, not much to add to it. I think, we continue to see increases across the state. From a hospital perspective, this today is the first time in a few weeks that we've seen a decrease in our numbers. Nothing to overly celebrate at this point in time, but we did see, a decrease in our numbers relative to what we saw yesterday. Added to, if we're tracking the actual R factor itself, over the last 72 hours was the first time we started seeing a decrease below 1. So there's some positive epidemiology, which is really, really good, but we continue to see an increase in overall hospitalizations. If you look at the data from the state yesterday, and we expect to see this trend within the next, watching it within the next 2 weeks. Any changes, I think, I don't expect to see drastic changes, at least for the next 7 to 14 days. And then a next set of data point will help our prediction. So that's where we are.
If anybody has questions, you can raise your hand or put it in the chat right now. Caitlin from NBC, go ahead.
Hey, can you guys hear me? Yes.
Yes.
Thank you, guys. Hi, gentlemen.
Hello.
I am wondering, we're getting a lot of questions from viewers about the difference between the third shot for immunocompromised folks and the booster. If you could help explain, is there a difference? What is the difference? And then I have a follow-up after that, please.
So the difference between a third shot and a booster, if that's the question, they're the same exact vaccine, the same shot. It's interchange in terminology. And we actually had that debate as to how do we market that, because what the CDC is saying, what we're saying, based on what the initial EUA and so forth. So the third shot is essentially a booster dose. That's what it is. If the other question is whether or not the third shot or the booster itself is the same exact vaccine, same dosage, same formula that's been delivered with the two shots before, the answer is yes. The actual formulation hasn't changed at this point in time. It is the same booster or same shot that's been given for first and second dosage. Yep.
I think that's really helpful. And for folks who are saying, all right, well, the vaccine was supposed to be, the panacea, and now we're needing a third, what would you say to those folks who maybe are feeling doubt when they hear about this booster or third shot? What would you say to them?
So, the vaccine itself, so if you look at our hospitalizations right now throughout the state, and you look at, I would say nationally, right? And if you look as well as, I often refer to the UK's data because they trend very close to us from an epidemiology perspective. They started seeing the Delta variant and its impact a few weeks before us, so about 6 weeks before we did. So if you look at all those data, would you look at the critical care management or the need for critical care for individuals who are COVID positive, about 99% of those individuals are not fully vaccinated or not vaccinated at all. So it shows vaccine efficacy. It's hard to question that with that level of data, scientific data. The other thing is when you look at the our immunocompromised population, the actual immunocompromised group, we know even before COVID-19, or before anything from an immunology perspective, we know they'll have a problem while producing antibodies as good as someone that is not immunocompromised. So we went into this knowing this. What we've seen additionally is from a population that has about 3 to 5% of its group being immunocompromised, we saw the individuals that have breakthrough cases predominantly are immunocompromised individuals. So with that level of data, I do understand why the CDC and FDA moved forward with advocating for vaccines for individuals that are immunocompromised. Now, regarding over 65 as well, we as a team look at that within Connecticut. The majority of individuals that we're now seeing within or especially in our breakthrough cases are individuals over 65. Could it be because of the timing of the vaccine for over 65? We're not too sure of that, but it seems based on the conversation that the FDA and CDC alluded to early this morning, is that's the belief with the scientists that are moving this forward. As it stands right now, vaccines very effective in our general population. Understanding the challenges of the immunocompromised group, it's not just based on COVID-19 vaccine. It is the nature of the beast of being immunocompromised. And with our patients over 65, we have some data that shows that that is one group that we should pay some attention to at this point in time.
Mike Savino, you have a question?
Yeah, I got a couple about the booster shot. One, is this a sign that, similar to the flu shot, this might become a regular thing where you need a COVID shot? Or is there something about a third shot and sort of giving your system another, test, another run at battling this, that you can sort of get longer lasting immunity with this third shot, that, this shouldn't just be a sign that we're going to need more and more COVID shots?
I don't know if we're able to conclude on that yet. I think, is this a point, if I was in the middle of making that decision, if I was without all the data, would this actual not mandate or this approval from the CDC and FDA, would this put me into a different direction of thought process? Possible. And would it be understood based on how the clinical, environmental, economical, social impact of COVID-19 is, and the fact that the vaccine has been effective in reducing those impacts? Yeah, I would probably understand that as well. But again, I don't think I think we're far out from making that decision. I also do justify the assumption. I can see how the assumption itself is justified.
And then we saw the World Health Organization earlier this month, and then again, in recent days, saying that they understand the science, particularly when it comes to the immunocompromised, but that we really need to be careful with booster shots and really trying to put a priority in getting vaccines to places that don't have access, that you're going to get a better public health payoff if you're just vaccinating people as opposed to giving booster shots. As vaccine providers here in Connecticut, I mean, how do we balance that? Should we be more strategic in who we're giving vaccines to?
I agree with WHO on that statement, and for a number of reasons. Myself, Dr. Cardon, Dr. Kumar, Mr. Flax, we've all said this, that this phase of the pandemic is focusing on one specific population from a clinical perspective, and it's our unvaccinated folks. We've put a lot of effort. We continue to put effort into ensuring that access is available. And, HHC's commitment to ensuring that no one get left behind where vaccination is concerned is still intact. So we're not shifting our resources to ensure that boosters are available. We're expanding our resources, expanding our capacity and capability. So we will still do campaigns. We're still doing educational forums. In fact, we have more educational forums that are active now than we've had in the last few weeks. So that will continue. We'll continue to do outreach programs. We'll continue to have mobile clinics and so forth. But definitely there's no replacement, there's no shift in focus, none of that's happening. And from a resource perspective, we have capabilities where infrastructure is concerned, and we have capability where vaccine is concerned as well.
Yeah, I want to reemphasize that this is an and. There is no coming off the work we need to do to get first vaccines to people and make sure we're providing the access, the education. That work continues. This will not be a shift of resources. We will expand our resources and what we need to do to meet the competing work that we have to do. But we still see that as a top priority to get the people who haven't been vaccinated yet front of mind.
That's a very, very good question. Thank you for allowing us to explain that.
And if I could just follow up real quick, and then I'll to the issue of resources, could we see some of these larger facilities coming back online, especially since you're also talking about anticipating a need for more testing in the fall, more people maybe wanting to get the shot? Could we see some of these larger sites popping back up and becoming available again?
It's a question we are working through right now. I'm fully transparent and happy to share. What we're looking at is the ability. We've moved to a distributed model to where we have plenty of access and plenty of more locations than what we had to begin with. To some degree, the reason for the large vaccine centers was both volume, but managing the vaccine and the way it was distributed, we had to centralize it. It was very hard to have, like we do flu, every primary care office distributing vaccine. We're in much better place to be able to, if you have your clinician, they should be able to vaccinate you in their office just like you get a flu shot. So that's going to decrease some of that need. from vaccinations. We are exploring whether we need some centralized locations to just handle the volume that's coming through. And so we're planning through that size scope. I don't think it will be anywhere near as big as we need it to be, but there may be some value in terms of vaccinations to have some of the sites we've had in the past, and we're exploring that. So that's the vaccine. The testing piece is twofold. There's a lot more technology and more testing options open to us than we had before as well. And we're looking to see how do we make this ever more convenient, meeting the appropriate turnaround times that people need to have information to make this work well. As we started, remember when we started testing, you had to go and somebody had to swab you. Now we're much more comfortable with self-swabbing and getting those tests done. So there are other opportunities that we're looking at to, again, decant the need to line up and get a test done to make that work when you look across the breadth of our footprint. So that work is also coming forward. So no definitive plans yet, but a couple of options that will potentially not require the big drive-through testing places that we have. Does that help, Mike?
Yes.
Good.
Dave Altamari has the question now.
Actually, that was one of them, but I have one for Keith. Keith, I listened to the White House press conference this morning, and the CDC director was pretty straightforward that they made it pretty clear that the vaccine, particularly it seems Pfizer, the efficacy wanes after 8 months. They must be basing that on data that we're not seeing so far. But you mentioned that you've seen some breakthrough cases of people over 65. Are those small numbers, or are you seeing that we're reaching this 8 month cutoff or whatever, and then people, the efficacy is not as great as it was?
Yeah, so I'm still not seeing. I'll answer that in a few parts. So with the regarding the CDC and the data that they're looking at, there's a few studies that's been out that definitely shows especially challenges with the Delta variant and COVID and the vaccine, right? In regards to our Connecticut data as it stands right now, and specifically with HHC, if I look at the patient population that we're seeing that falls within that breakthrough category, we have a good percentage that is, so over 30, over 40% of those individuals are over 65. However, if we look at the vaccine, and what we've been saying is, how do we measure efficacy for this vaccine? For me, measuring efficacy is not the breakthrough, is whether or not these patients are critically ill. If these patients, especially patients with advanced age, with comorbidities, if I get a phone call a year ago that one of these patients have COVID-19, the expected mortality is significantly high, right? That's a difference. So we've changed that conversation completely. So with that being said, the vaccine is still very, very effective. If they're measuring it by actual breakthrough, yeah, there's clear evidence that are individuals over 65, and it could very much be the timing that they got the vaccines first. But I would also be seeing that in our healthcare providers. We're not seeing that in our healthcare providers. And I would also be seeing that in other population, and we're not seeing that. So again, it's challenging to break the data down for it to for us to appreciate everything that we're asking. But there's a few things that we can clearly see is that it's still effective in the ways that we need it to be effective in protecting our population, especially from critical illness and from death.
Dave, in my simplistic view, there's a little bit of calculus that everybody's doing. You can wait till you've sort of lost control and then catch up with it, or you can be cautious and try and get out in front. And if there's early signals that are suggestive, better to get out in front of it, and then you can continue to tack from there a little bit. And that's my sense of what's going on. We certainly see that the Delta variant is an upgraded animal, if you will, from the problem we were dealing with at the beginning. There may be other variants out there that we don't know about yet that you're trying to anticipate a little bit. But I think that's part of the calculus they're doing. We don't want to get into a situation to where we're now playing catch up again when we have vaccine and we can administer it. as we go forward.
Just a quick follow for Jim. You mentioned that you've started doing some vaccines, a few vaccines of immunocompromised. I'm sorry, I always screw that number up.
You did fine.
Do you have a sense of what your universe is of people that you vaccinated the first time around with that were in this group?
Yeah, and we've made it open so that you can either schedule an appointment or walk into any of our sites. Somewhere around 10,000, Dave, is what we've got as an initial tranche. Keith, I have that number right?
Yep, 10 to 12,000 is what we expect to see within our group.
Yeah.
Alex Putterman, you have a question?
Yes, you guys have kind of been answering my questions as I've had them, as usual. But I'm wondering if you could say more about how exactly the booster shot campaign is going to look, and whether to what extent you anticipate we're going to have the same kind of backlog of people that we've had in the past. Is it going to be as hectic and crazy trying to get your shot as it was the last?
No, so I'll start. No, two things. Vaccine much more prevalent and available, right? So we don't have the trying to. We've only got so many available, so that we've got plenty of vaccine, and there's plenty of access even beyond what we do. And we're trying to be very prescriptive to make sure that we can keep this in control. The good news is that you are protected now, so there isn't also that anxiety pushing you to say, I got to get vaccinated now before I get sick. We're ahead of that. So that we're proactively reaching out to all the patients that we know of and inviting them to sort of get vaccinated and schedule your appointment if that's most convenient for you, or it's always available to walk in. We've anticipated the announcement around the rest of our population, and we're already doing the work to get that data sort of ready so we can use a similar tool to reach out and let people know in a controlled fashion that, hey, we know we did the 65-plus-year-old first, 75-year-old first, 65, et cetera. We can sort of start scheduling that to try and smooth that out somewhat, to allow it not to be necessarily a scramble to find appointments. We should have plenty of capacity. So that's what we're trying to do to make that experience better than last time.
We have a question in the chat from Brian Hallenbach. He asks, are we seeing any evidence that we're making inroads against vaccine hesitancy, and what's the response been to the reinstatement of the hotline?
So I'll speak to the hotline real quick, and then I'll let Keith talk a little bit about the group that we continue to work with in terms of getting vaccinated and the approach we're taking there. Hotline not particularly busy. There's ongoing questions, and it was set up very much to try and deal with the people who have questions or are probing or open-minded or trying to make decisions about vaccine. We're seeing some of that. We're still seeing questions come in around testing or exposures. That always is confusing for folks as to what they do with that. So those kind of questions continue to come through. Volume has not been, we were seeing 3,000 calls a day. We're nowhere near that. We're in the double digits kind of calls, 40, 50 kind of thing coming in the time we have. We do expect that'll ramp up some. They are able to help navigate people to appointments. So we've used the call center to create appointments for those that don't have the wherewithal, the tools to make them electronically if they're having trouble finding out where they can get a vaccine or a test done. We're assisting with that as well. Like I said, volume of calls is not overwhelming at the moment.
So I did put in the chat regarding for 80 patients in-house right now, 37 or 46% are over 65. Additionally, of the 24 breakthrough cases we have currently, 19 of these patients are over 65, which represents 80% of our breakthrough cases. So even in Connecticut, specifically at HHC, we can appreciate that data. Again, most of these patients are not in critical care. So we're in a very good position where efficacy is concerned, measuring efficacy based on impact of the disease to prevent critical illness and death.
And Keith, are you seeing any evidence that we're making inroads against the vaccine hesitancy? Have you seen that?
Yeah, absolutely. We're definitely, a few things happen. And if you look at national data, I think over the last few weeks, vaccine has gone up exponentially in this country. In fact, there's some days we're tracking about 1 million vaccine per day. And one of the things that I think slowed down vaccine delivery and compliance to the vaccine, compliance is probably not the right word, but people accepting or using the vaccine, we went through a period of, is COVID-19 gone, right? Is the pandemic over kind of thing? And people got into that, if I haven't gotten it yet and I haven't gotten sick and everyone else seems to be doing good, why should I get vaccinated? Then we start seeing this uptick that has been created by the Delta variant. And then we see a rush for testing and we saw a rush for vaccination. So the message is getting through, but also there's a visceral impact of seeing other people getting ill and seeing the community present of pandemic, of the COVID-19 pandemic being up again. The awareness is up again. So there's definitely an increase and increase to go get the vaccine.
There's no question, and we know this, that as much as we like to think we're going to do the, sort of take care of ourselves and do all that, there's nothing like threat to motivate. It's just a more motivating factor. And there's, we don't want to scare people into getting a vaccine, but getting their attention and realizing this is not gone and it's really still an extremely lethal disease brings focus and attention to what we're trying to achieve.
This question is from Ciara. She asked, and I think you did answer this, we've already started vaccinating people with the booster if they are eligible. Then this is from TIC. They say, can you comment on Fairfield County being the latest county to join the CDC's highest transmission category? Any thoughts on if or when the 3 counties will cross into that level?
So they might not cross over. They might not cross over because of where we are right now. Are we at the plateau? Are we seeing a decrease? And we've been seeing decrease in rates of increase over the last few days. So they might not cross over. Fairfield is really, the epidemiology in Fairfield is very, I hate to use the term weird, but it's hard to really use numbers out of Fairfield to represent Fairfield only, because a lot of individuals travel to and from, like New York, for example, and come into Fairfield for multiple reasons. So it's very, in the state of Connecticut, Fairfield is not a good representation of what's going on in Connecticut. So I'm generally not using them for any predictive modeling. But within the other counties, it's hard to predict right now. I would say there's a chance that they don't cross over. If they do cross over, I expect it to happen. I'd have to look at their numbers, but based on the last of the numbers I looked at, that would need to put them over. At least 1 or 2 of those counties might not cross over at all.
And then this looks like our last question from Caitlin from NBC Connecticut. She asked, immunocompromised folks who got a 3rd shot already, will they need a 4th shot?
Right now, so what we know about it's no. So we're hoping that booster will, one, increase their immune response overall. And we will start seeing the benefit. If we start seeing a majority of immunocompromised individuals, that 3% population, if we have 80-90% of that 3% population getting their 3rd dose, then we see how that impacts that 44% we talked about before. And if that 44% is impacted, then we're in a much better position.
Great. Do you guys have any final thoughts you want to give before we wrap up, or are we good to go? Anybody have any other questions?
I think the statements are still the same. Like, we're committed to delivering the message to ensure that education is available, to ensure that access to testing is available, to ensure that access to getting vaccinated is available. And we continue to ask that individuals be vigilant. One of the things that I steal from this team is the fact that personal risk assessment is important. Identify your space, identify individuals around you, identify individuals within your community, within your family that are most vulnerable, protect them as much as possible. And we're always, I think, easy to reach. So feel free to reach out and we'll be more than happy to help with any other questions that come up.
Appreciate you all coming. Hopefully this is useful for you. Give Melissa feedback if this could be done better. She'll filter it and deliver the message to Keith and I in a nice way if we could have done better. But really appreciate everybody's time and attention and all you're doing to keep this information front and center and to continue to further our ability to manage this pandemic. It's an important role you guys play.
Awesome.
Thanks. And we will, oh, yep. And they said thank you back. And we will send out the link for people who are eligible for the booster to sign up when we send out the recording of this briefing. So thank you, everybody for joining, and have a great day.
Have a nice afternoon.
Thanks, everyone.